Hi, my name is Hannah. This is my sports performance coaching and science midterm practical. So in the next clip is the manual muscle testing that I'm going to be doing with Elia. And so the first manual muscle testing and exercise movement that we did was the dorsiflexion lunge test, and then it went into our multi-joint compound movement, which is going to be a landmine squat. So I picked the landmine squat because of Elia's, this is specific to my client, and it was the mobility of her ankle was pretty low. It was just under a normal range, and that is due to multiple ankle sprains and just the development of scar tissue over time. So that is something that I want to be mindful of. And then the next movement in manual muscle testing that I performed was for the pectoralis major. And so Elia had no pain or restriction in her pectoralis major, and so I gave her a grade of 5. And then we did the lying chest flies after that, and that was my isolated movement. So thanks. Okay, so now we're going to be doing the dorsiflexion lunge test with Elia. So a normal range is about 5 inches, which is about the width of your hand. So what Elia is going to do, we want the heel on the ground, and we want her knee to be able to touch the wall. So Elia, is your heel coming up just a little bit? Okay, so we're within normal range, but if you bring your foot in just about an inch, can you keep your foot on the ground? Mm-hmm. Okay, so there's some limited ankle mobility. This one, this is her right ankle. It is a little bit better, but her left one, there is reported scar tissue because of how many times she's rolled it, so that's probably why. We're going to be teaching my friend Elia how to do a landmine squat, which is a multi-joint compound workout. One of the pros about a landmine squat is that you can load it with a lot more weight. You can use it in, all you really need is a barbell and possibly a dumbbell if you don't have a corner of a room, and a plate. And so what we're going to do with our setup today is we're going to have it in the corner of our room. We loaded just a 35-pound plate onto it. And so now I'm going to show you how to get into position with the landmine squat. So one of the first things we do is we just have shoulder width apart, maybe a little bit further if needed. And so what we want to do is we don't want to use our back. We want to fully use our legs to bring it up into our chest. So we're just going to grab it, hop up quickly, and move it into a symmetrical hand movement. Keep our hands, we don't want them like this or anything like that because it can put a strain on your delts. So we want them to be symmetrical. We're also going to line up it with the chest, so elbows are locked in. And then for a standing position, sometimes somebody who has a longer femur is going to want to stand back further because of the angle of the barbell. It is going to press into your chest. So for this, we're just going to go, you can mess around with the feet placing it all the way down, back up, and breathing slowly and controlled throughout. Okay, so now Elliot's going to perform the landmine squat, and I'm going to walk him through it. So one of the first things you're going to do is just get a shoulder width stance, and you're going to not crisscross your hands underneath, but just bring it, pop it up real quick, use your legs. Good, and then step into that. Make sure your fingers are interlocked now, and your shoulders are locked, or your elbows are locked on your side. And I would take a bit of a step back from there. You can mess around with that. So now let's go into that squat. Okay, yep, back up. Okay, let's take a small step inward and make sure that let this rest on your chest. There you go, perfect. Okay, now squat in again. Deep squat, back up, looks really good. Okay, a couple more reps. Good. So concentrically, we are working the quadriceps. Eccentrically, we're using the gluteus maximus. Good job. Okay, so today we're going to be performing the pectoralis major manual muscle testing on Elia. So I'm going to have you lay down on your back. Yeah, perfect. And now I'm going to palpate her upper pectoralis major, and I'm going to have you lift your hand to the sky and then bring your hand to your pocket. No resisting against me. Okay, now bring your hand to your other shoulder. Good, so there's no resistance, no struggle. Did you feel any pain? Mm-mm. Great, so that's 5. Next up, we're gonna move into the single joint isolation movement. So we're gonna be doing lying chest flies. So for this, I'm gonna have Elia, my client, laying on the ground. You can use a mat, you can also use a bench, but for right now, we're just gonna use the ground because it really doesn't require much. All it requires is two weights. So right here, we're gonna sit on the ground, and we're gonna start with our legs. We can just fold them, be in a comfortable position, and then we're gonna lie on our back and have our weights right here on the chest. Feet should be flat on the ground, back should be on the ground. And we're going to concentrically bring them, elevate them above our head, and then move them to the sides. So this is horizontal adduction and abduction, working in the frontal leg. So now I'm going to have my client Elia be working on this. So she's going to lie on her back, and she's going to grab the weights, and she's going to bring them all the way to the ceiling, and then move down with them in eccentric motion. This is working the agonist of the deltoids in the eccentric and concentrically working the pectoralis major. And so what she's doing really well here is keeping her elbows towards the ceiling. Often the mistake is twisting those elbows and the weights in the palm going down. Slow and controlled motion in the frontal plane.